It's a perfect summer afternoon. You're sitting in the sun, enjoying a fresh meal outdoors. You brought along some fresh raspberries, a bit of cilantro, or a crisp pre-packaged salad. It feels like the healthiest choice you could make. Then, exactly 1 week later, your body reacts. It behaves very differently than the bacteria or viruses we usually associate with stomach bugs. It travels across the globe, hitching rides on international produce and in contaminated water supplies. That healthy summer salad you enjoyed a full 7 days ago was actually the moment you were infected. Cyclospora has a slow start. After you eat the contaminated food, nothing happens for a while. It takes a full week and sometimes up to 2 weeks before you feel a single symptom. During that hidden week, the parasite settles into your small intestine. It begins multiplying, taking over the space and triggering severe inflammation. While this feels like a standard stomach flu, you don't have to worry about giving it to your partner or your children. You cannot pass Cyclospora directly to anyone else in your house. When the parasite leaves the human body, it isn't infectious yet. To become active, it needs to sit for days or weeks in a hot, humid environment, like warm soil or water, to ripen. This specific life cycle is why the bug usually affects only one person in a home. It breaks the normal patterns of how a sickness spreads through a family. If you take a typical trip to the doctor and they order a standard stool test, they will likely miss the parasite entirely. Cyclospora is small and often blends in with other materials in the gut, allowing it to stay hidden during standard lab work. Finding it requires a more targeted approach. Doctors have to use specialized DNA panels or chemical dyes to make the parasite visible under a microscope. This image shows what happens when a laboratory uses a modified acid-fast stain. The round parasites are forced to glow bright pink and deep purple, making them stand out clearly against the blue background. Reaching this diagnosis requires a very specific set of tools. If the laboratory isn't looking for this exact parasite, it will remain invisible. Once identified, the parasite is remarkably easy to clear. Unlike viral stomach bugs that just have to run their course, this is an infection that can be targeted directly. The treatment is a straightforward 7 to 10-day course of a common antibiotic combination, known most often by the brand name Bactrim. The relief is usually fast. The medication stops the cycle of misery, halting the weeks of weight loss, exhaustion, and physical distress. Knowing exactly what is causing the illness changes everything. It turns an endless, exhausting problem into a temporary one that is easily solved. Total prevention is difficult because our fresh food supply is so large and complex. Even if you wash your vegetables carefully, the risk still exists. Instead, watch for context. Pay attention if you have recently traveled to regions like Southeast Asia or Latin America, or if you've been eating imported fresh produce during the spring and summer months. Stomach bug that lasts more than a few days? Talk to your doctor about the timing. Tell them exactly when you ate fresh produce and ask specifically to be tested for parasites like Cyclospora. When you provide the right timeline and the right questions, you are no longer just waiting to get better. You are equipped with the information needed to resolve the issue and protect your health.